prostate cancer early. Important thing to know is that not every person who we find prostate cancer needs to be treated, needs to be biopsied, but finding about the cancer early makes all the difference because there are many options, including watching the cancer early.
Yeah, there's some symptoms, I guess, that do occur. A frequent urge to urinate, back pain, for example. We're going to put it up on the screen. Frequent urination at night, weak or interrupted urine flow, blood in urine and semen. Once you get to that point, though, what do you want to see, and how do you then treat prostate cancer?
You really don't want to have any symptoms because of prostate cancer, because some of the symptoms, they overlap with the benign prostatic hyperplasia, like getting up again and again in the night, having a difficulty in passing urine. But if it is happening because of BPH, it's very easy solution. But if it's happening because of cancer, that means we waited too long. We would rather find cancer by PSA and the imaging rather than by the symptoms. So if they are having these symptoms, they need to go to a urologist to check it out. What's the reason for that? And 9 out of 10 times it will be a benign prostatic hyperplasia, for which we have many small treatments, drugs, and evaluations.
And for PSA screening, Mount Sinai recommends a baseline at 55 years old. So, folks, if you're a man and you're 55 years old, that's the baseline screening. All men over 55, they say, should get it. Black men over 45 years old, because the rate is 70% higher for African Americans. That's a concern, Dr. Tewari. How do you speak to that?
Not only that they have a higher incidence, they have to double the mortality. So we need to start early on in black men, and that is the reason we have started in what we call a strong million men for prostate cancer detection. We have a mobile unit which goes out to different areas to find the cancer early, and now we are expanding and partnering in different parts of the world. And we are going to reach out over 1 million men in the next 10 years and find their cancer early, because finding the cancer early not only has an impact on mortality, but it also has an impact on the quality of life. That if you find the cancer early, not only that you can save the life, you can also do things to make the cancer treatment a little bit more tolerable, in terms of they don't have a sexual dysfunctions, they don't have urinary leakage. A lot depends on when you find the cancer. So this mobile unit has already crossed 6,000 men right here in New York, and we are now thinking about taking it to Atlanta, to Washington, and to other parts.
We're looking at the mobile unit now, and what strikes me finally, Dr. Tewari, is many men you know how men are. You don't want to go to the doctor, you think you're okay, you want to put everything off, and you're reluctant to get a test. And a PSA test, it's very simple. You just get a blood test. What would you say to any viewer now watching who could be reluctant